So the family practice residency program is near and dear to my heart, and is really, I think, the heart and soul of the entire hospital and clinic system and mission.
The system really embraces the residency program and values that educational mission, and that speaks to all the people, everyone from people who work in our cafeteria to the nurses, public health, as well as all the doctors and administrators. They just really embrace the residents and the residency training and value that mission. And you can feel that here.
This system has had a long tradition of training family practice residents not only to do family practice, but also to take on a much higher level of specialty care than most programs offer. We've had a tradition of family practitioners taking on specialty positions in our system, and that has really led us to the concept that specialty services ought to be used appropriately, but shouldn't be over-relied upon.
There is an esprit de corps here. Some of that comes from the founder, and he came here and he wanted to teach generalists how to do surgical procedures. His other idea was to create a third tier of providers. So instead of having the primary care providers here and the specialists here, he thought, let's insert another level of providers. They were residents who just finished the residency. They were asked to stay, do primary care clinics, but choose a specialty that they'd like to develop special skills in. And that was attractive because it added variety to your schedule.
People are still drawn to the idea of a family medicine philosophy and broad spectrum training and having independence with that training and innovation. And I think that word of mouth and reputation have been really important, and it's been known for years to be a really strong program, and people kind of know this is where you go if you want a really different kind of training.
Family medicine here is really a big part of our entire system. And our residents, when they come here to train, they see family physicians who are doing all kinds of things. And it really gives them models to say, I can take family medicine and mold it into whatever I want to do in my career as a family doctor.
I kind of wanted to design my own residency. And so what I started doing was going to different programs, websites of all different specialties and looking at what their rotations were like. And I realized when I got to the Contra Costa website that the rotations that they did is what I would want to do if I designed my own residency. And so I thought, well, this is an amazing fit.
I think what's really important for people to understand about our residency program is that as healthcare evolves, our program is evolving to provide the family physicians of the future. We're not losing sight of the basics and the past and what's really important about family medicine, that care of the whole patient. But we are also thinking about what is the future? What is it like to be a doctor in the mid-21st century? And how do we prepare our residents to be those physicians? And I think those two things together are what's really important about our program.
We've turned out a large number of physicians, number one, more importantly to me, who've stayed on in our system and have continued to provide the service and also the resident education as needed. But more importantly, we've also supplied the needs of other health systems in our county. Kaiser, Sutter, John Muir. A number of our physicians are working throughout the county. So I think the wisdom of having a training program, Dr. Degnan's idea way back in the 50s and 60s, really has been the nucleus for the success of our system. And I have great respect not only for him and his foresight, but also great respect for all of the residents that we've turned out who are so crucial to our health system and to our community. You can build a system with fully competent, trained family practitioners. You can offer the full spectrum of care. You can use specialty services as appropriate. But more importantly, you can provide a training ground to attract the best medical students from around the country. And I think we should be proud now that we get, I believe, between 700 and 800 applicants every year for our 14 positions from the best medical schools in the country, indicating how highly valued our training program is.